Hi there, this is Marielle Conception, your host of the My DPC Story podcast. Have you or someone you care about ever been burned by the U.S. healthcare system? If so, you are listening to the right video, because if you are listening, chances are the answer is yes. But the U.S. spends so much on healthcare. Why are so many Americans affected personally and especially financially by the healthcare system? Shouldn't that mean we have better healthcare access and treatment options? Shouldn't it be easy for us to be able to see our doctor when we need to instead of turning to the ER or urgent care? Historically, it's been seemingly impossible to answer these questions. But now that is changing through the direct primary care movement. This video that you have tuned into will bring you into the world of direct primary care and show you how physicians all over the country are changing the way they practice so patients from all backgrounds get the high quality care they need and deserve, which makes for both happy patients and physicians. Learn even more by subscribing to the My DPC Story YouTube channel. Find us on all major podcast platforms. Find us on socials at My DPC Story and at mydpcstory.com. There you can find resources including how to find a DPC doctor near you, conferences about DPC, DPC startup guides and advice, a store with DPC swag, and even a mapper showing where podcast guests are practicing. Thanks for tuning in to hear about this powerful movement. Now, on to the episode. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Conception, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care is about recentering the doctor-patient relationship. It is about collaboration, relationship. It's about love and community. For me, it's about finding harmony in my practice, in our practice, so that it is joy-filled, it is sustainable, and it is life-changing for us as doctors and our patients and families as well. I am Dr. Jalon Burton, or Dr. J, as my patients call me, and this is my DPC story.
Dr. Jalon Burton, or Dr. J as she loves to be called, is a pediatrician, wife, and mother of three with over 15 years of experience in well and sick child care, complex care, children with special needs, public health, youth development, and managed care. Dr. J is a proud University of Virginia graduate, and she attended Columbia University for her Master of Public Health degree, and for her medical degree, she attended the George Washington University School of Medicine. She completed her internship and residency at the University of North Carolina's Pediatric Primary Care Program. Through her practice, Healthy Home Pediatrics, Dr. J collaborates with families to provide comprehensive primary care that integrates traditional evidence-based interventions with customized plans that prioritize healthy foods, quality sleep, integrative medicine, and healthy family routines. When Dr. J is not providing excellent patient care, she is spending time with her husband and their three children, 2 boys and a baby girl. She is actively involved in her community as a volunteer clinical instructor at the George Washington University School of Medicine, local parent-teacher association, and her community association. Dr. J enjoys listening to podcasts, cooking, urban gardening, and exercising. Welcome to the podcast, Dr. Burton.
Hi.
You are all the way on the East Coast and I'm all the way on the West Coast. So I'm so excited to have you on the pod. And I wanted to start off with the name of your practice, Healthy Home Pediatrics. And I feel that reading your bio, where you talk about a holistic approach to pediatric care and the care for families, I think that the name says it all. But I would love if you could tell us more about your practice and how you are running your practice out of patients' homes.
Yeah, thank you so much for having me on the podcast. I just think it is so amazing that you are doing this podcast in addition to being a mom and starting your DPC practice. I think it's amazing. And I'm so proud of all of us for doing this and changing the game, not only for our patients, but for our families. You know, our kids get to see us do these things and then they get to know how big they can be as well. And I think this is what the world needs, for all of us to like be as big as we can be. So I always say that when patients are truly supported, that they thrive. I have a background in public health and in medicine. And for me, house calls and DPC are like where it's at, because when you really center care on patients, most of what they do happens at home. And as a pediatrician, I need to see what's happening at home. I need to see what's going on. I need to see where you're eating, where you're drinking, where you're having lunch, all those things. And the reason why I started this practice was because I had so many mentors who were finding really innovative ways to reestablish care with patients, to recenter care. And it's really about relationships. The best doctors, the doctors who inspired me the most when I was a medical student, the doctors who inspired me the most as an attending, were those doctors that found ways to have relationships, like true, meaningful, lasting relationships with patients, which is really rare in medicine these days, right? But I knew I wanted to practice in a medicine in a different way. And I knew it had to be unrushed. I knew it had to be sustainable. I knew it had to be joy-filled. I know I keep going back to those things. And for me, that's like sitting on people's couches and sitting on the floor with kids and playing. That's my 4-year-old patient bringing me peppers that he cut out of the refrigerator to show me he's eating fresh food and literally shoves them in my mouth. And I'm like sitting there being fed by 4-year-olds in their houses. That to me is the epitome of my practice. Healthy home pediatrics, like the name, it just came to me after just like thinking about what I wanted it to be, thinking about like what I wanted it to feel like. It came, and my husband, who is a writer, was like, "Ooh, that's wonderful. Those are great. Like, it just sounds great. It looks great." And that's the practice.
That's wonderful. And kudos to you, because also I love your logo in that the classic, this is where the location is the pin on the map. It's all incorporated with the heart. It's absolutely wonderful. So if you haven't seen Dr. Burton's, or excuse me, Dr. J's logo, check it out. It's awesome. Now, I want to go back to what you mentioned in terms of the experience you had come from prior to opening Healthy Home. Mm-hmm. So you have over 15 years of experience. And I want to ask you, in terms of along your journey, how did you come to learn about direct primary care?
Yeah. Oh, wow. So so I was always that kid that knew she wanted to be a doctor. I was like 3 and 4 years old, like nurse's costume, that I was like, y'all need to switch this up and make it a doctor, because I'm going to be the doctor and I'm going to be in charge. And so my parents were just like, yeah, you always said that. So my parents were amazing. And my grandparents were amazing in just every single science engineering program that there was that was free or low cost. I was in it. They enrolled me in it before I even reached the age cutoff in some of the programs. I was like the youngest kid in there. And so it was really my parents. So I knew I wanted to be a doctor, went to the University of Virginia, did a lot of public health and peer mentorship programs. Like, I've always loved communicating with people. I've always loved to have innovative ways of wellness. And so I was a peer health educator in undergrad. And then I did some international work. And I just started working with public health professionals. And I was like, wait. Like, the doctor-patient one-on-one is great, but if I don't understand these determinants of health, if I don't understand these kind of like systems and organizations and processes, I'm never going to make the impact that I want. And I decided to get my MPH and went to Columbia University and got my MPH. And so after that, I started at UNC for my residency. And I think going to a Southern program was great because I got such a wide range. What I've seen is, especially students that come from like Southern schools or Midwestern schools, we got a lot more hands-on training in a big variety of things. Like, I was running a code my first week of intern year. And my students in DC and my residents in DC, there's so many specialists, they don't get all that hands-on training. So I got so much hands-on training at UNC Chapel Hill. Shout out to my crew there at the UNC program. And it was wonderful. So I actually started doing house calls as a resident. In the UNC primary care, we had a pediatric primary care track that became a pediatric primary care residency. And so I did house calls with one of my mentors, Allison Kavanaugh, for medically complex kids. I did house calls with the newborn nurses. And the whole time I was there, I was like, oh, doctors should be doing these house calls so that they can prescribe, they can diagnose, they can do everything right there in the home. So right out of residency, I got what I thought was going to be my dream job, like so many of us. And then it was toxic and terrible, right? That's just the story. And I can say that now without crying. A few years ago, I wouldn't have been able to say that, but it was terrible and it was toxic. And all of these, especially women of color that had trained me as a medical student, were in the same positions, making the same amount of money. Nobody had been elevated. And I just looked around and they were all burnt out. And I was like, nope, no. My husband was like, absolutely not. They're all taking their computers on their vacations. Nobody's getting vacations. Nobody's being respected. Nobody really has a voice. These big, huge institutions. I was at a leading academic institution. And I said, no, like that. I feel like that's the DPC story, right? That everybody, like we try, so many of us try to fit in these systems. And so I left academics and did private practice and also did some Medicaid work. I was the medical director and the interim chief medical officer for the DC Medicaid for children with special needs. And it was such a wonderful experience, such a dynamic experience. I was supervising care managers and nurses who were doing house calls. And I kept being like, DC government, pay me, let me go and do these house calls. I will keep these kids out of the emergency room. I'll keep them out of urgent care. I will make sure all their medicines are good. And I kept getting no, like that's not the way we get paid. Nope, that's not the way the system is set up. Nope, that's not the way we do things. And I was like, no, just pay me my salary and pay my loans off and I will get this together for you. Nope, that's not what we're going to do. So I kept, running into no's and no's and no's. And thankfully, I did a leadership program with the American Academy of Pediatrics. And I was able to spend 2 years researching practice management, interviewing doctors. I interviewed every DPC concierge, like you name it. I was like, hi, I'm working with the AAP on a project. Tell me about your practice, like you're doing with your podcast, just asking people their stories. And I kept being led back to DPC, led back to DPC, led it back to DPC. And then one of my mentors from GW, when I was a medical student, Dr. Matthew Mintz, had a DPC practice here in Bethesda. I went up to his office. We ate and had poke. He became one of my best mentors. And then I was like, let's do it. Let's open up the practice. So I opened up in 2019 and did locums and moonlighting for a few years to cover the cost of everything. And now it's just all in with the DPC. So I just wanted a model where it was me and the patient, and I couldn't deal with the insurance companies anymore. I know that they're very important, but I think for primary care, that it's not set up for primary care, right? Like it's not set up for relationship-based primary care. Like insurance should be for acute things that happen that are out of your control, not the regular maintenance and wellness and health.
So just for the listeners, I feel that my cup is so filled talking with you, Dr. J, but also I'm sure you can picture how happy and glowing she is talking about her practice because she has chosen her path. And when you talk about women in color, doctors of color, as well as your children seeing you, you had this amazing encouragement by your family and you're showing your children what you can do as a person of color and as a female of color in medicine. I literally have these tingles inside of me because I am so happy for you. And the fact that you have already passed your 2-year mark, you're 2.5 years well into your practice, and you are making a difference in each and every family's lives that you take under your care. So kudos to you. You did it. You are doing it. And I hope that everybody, if you haven't visited Dr. J's website also, check it out because right on the front, it's her smiling. So it's amazing. So there you go.
With that cute kid, you must point out the very cute patient on there whose mama is a wonderful photographer. But it's the patients, like they're just amazing. They're so wonderful. And when they get access to you and they know they have somebody that they can call literally anytime they need, first of all, they don't abuse you and call you whenever they want to. I know people are usually worried about that. They're like, oh, they have your cell phone. I'm like, yeah, they have my business cell phone, not my personal cell phone. They have my business cell phone and they can reach me all day. I don't get calls overnight because they call me as soon as things are going on. They call me during the day. I check on them. We check in again after lunchtime and nap time. We check in again at bedtime. We check in again in the morning. It's a different model of care. It's not the same. And so that's what I tell a lot of other women of color who are interested in opening up their own practices. I'm like, you gotta think of this as being completely different. What would you want? And make that for your patients. And then you will see they will be well taken care of. You will be taken care of. It will be okay.
And I just think about even this week, there were two families that needed care, and I just handed in my 60-day notice for my fee-for-service job. But at the same time, like I think about, I'm in this gray space of I haven't yet opened, but I mentally am already there. And I have been able to call them, but I don't care that I'm not getting paid to talk with these people, because I know that very shortly I don't have to worry about that. I don't have a code to code for the fact that I'm calling you. For the hour I spent talking with you before you actually were scheduled in my clinic, because I knew that I didn't have enough time to spend with that family or that patient in the clinic. So I did extra work just to make it a thorough visit. So when you go back to that joyful relationship-based care, that's exactly it. You are able to give the care when your patients need it.
Yep. And they understand when you got to put a baby down or you got to change a stinky diaper. I'm like, let me call you back after this diaper, girl. And they're like, okay, Dr. J, just call me back. And they do. And it's just different. Yeah, it's so different.
No, I want to ask, because you had this amazing quote on your Facebook page by Angel Kyoto Williams. And the quote was, without inner change, there is no outer change. Without collective change, no change matters. So I want to ask about, as you were learning from Dr. Mintz, your other mentors, as you were interviewing these pediatricians and other primary care doctors, when you were exploring this possibility of opening up your own clinic and realizing in your job that this was not going to work for me doing it the insurance-based way, what was your journey like between when you decided, like, I'm going to do it, and when you actually opened your doors?
Yeah.
Stay with us. We'll be right back. My DPC Story just hit 100,000 downloads on Apple Podcasts alone, and we could not have done it without our amazing listeners. So to thank you and to celebrate this milestone, we're giving away an incredible DPC Summit prize package for the DPC Summit happening in Minneapolis this summer. The prize includes My DPC Story swag, and on top of that, the prize also includes a ticket to the DPC Summit. Check out my interview with Dr. Jeff Davenport, where you'll hear more details about the summit. To be eligible for this giveaway, all you have to do is first rate and review My DPC Story on your podcast listening platform. Pro tip, if you rate My DPC Story with a 5-star review, it helps the visibility of the podcast and it helps others to find all these DPC stories. Number 2, take a screenshot of your review and email it to support@mydpcstory.com. You'll find that email in the show notes as well. And third, make sure you're following My DPC Story on all your social media platforms: Instagram, Facebook, TikTok, YouTube, LinkedIn, and Twitter. All the social links are at the bottom of mydpcstory.com and also in our show notes. For bonus points, share both this episode and the My DPC Story posts about the DPC Summit with your community. The winner will be announced in a future episode, so make sure you tune in to find out if you'll be heading to the summit. If you've already purchased your ticket and you're the winner, My DPC Story will send you a check for the price of your ticket. Thank you for listening to My DPC Story, and best of luck.
I guess it was like 3 years. I tend to really take my time with things. I'm very intentional about things. I wouldn't say I'm risk averse, but I was a very reluctant entrepreneur. Like I graduated from UVA and I spoke to UVA pre-medical students last week, actually. And when we were talking about my journey, I'm like, I embraced the fact that I was a reluctant entrepreneur. First of all, I think our education, there's just such a paucity of information about starting your own practice. So I would say I really listened to my inner wisdom, right? Like Angel Kyoto Williams is like master Black Zen yogi. Like she's amazing. I don't think I'll ever be as Zen as she is, but I'm going to try. And so I just had to be like, what does my heart tell me? My heart tells me I cannot do these 10-minute visits. My heart tells me, and my public health training tells me, right? Like I'm also a student of science and a student of history. And when we look at outcomes, our outcomes are terrible here in America. Our infant and maternal mortality, which is one of my passions, it's abysmal. And we cannot continue to do the same things and think we're going to get different outcomes. That's that's insanity. Like it doesn't work that way. Like you can't do the same things. You see your burned out mentors. You can't do the same things that they're doing in the same way and think you're going to get somewhere different, because you're not. You're going to end up in the same place, or maybe even a worse place. And so for me, that journey was about being real and honest about what was going to work and what wasn't going to work, right? Physician burnout's at an all-time high. Physician suicide is a terrible rate right now. Patient outcomes are not great and getting worse. And so I said, we need to do something different. Like we full stop, do something different. I think I read, what was that book? There's a book called Getting Off the Treadmill. What is it called? Is it Stop Burnout? Stop Physician Burnout. Yeah. And he talks a lot about how you're on this track as a doctor through training. But at the end, you need to decide, are you going off road or are you staying on the road? The road is leading you down a path that you don't want. Figure out where you want it to be. And I knew I wanted to spend more time with my patients. I knew I wanted to work with them in innovative ways. All my bosses, when I was like, oh, we should be doing video visits. I said this 10 years ago. I said, we should text with the patients 10 years ago. And my boss said, no. I said, we should get scribes. You're not allowed to do that. Where does it say that I'm not allowed to get a scribe? And actually, the research shows that if I get a scribe, actually, I'm focusing more on the patient and patient outcomes are improved. So what are you really telling me? Some of the things that people were telling you, it was a lie. Like it was just straight up a lie, because that is the way that they were trained. That is the box that they put themselves in, and they didn't want to see outside of it. And so I had to like take those blinders off and bust out of that box so that I could be happy in the way that I needed to. So it was really just like research. I went back to being a medical student. What do we do when we don't know a diagnosis? We know what the problem is. We know we've got some resources. So I went every website I could find, every book I could find, every person who would talk to me on the phone. I went back to like undergrad. I went back to that to figure out how to make something else happen. So that was my journey in starting the practice. It was just doing research, being real and honest with myself, and finding mentors. And mentors could just be for like a day. Like right now, we're being each other's mentor. It doesn't have to necessarily be ongoing. I'm learning from you. We had a wonderful talk before we even started recording. You're learning from me. That's mentorship right there. And so we take a few lessons, like I'm taking notes, like I took notes in our pre-call, and then we move on. So yeah, so I think that's the main way that I went about things.
And you are very focused on making sure that your cup is filled, that you are not following that path of burnout again.
Yeah.
I want to highlight here that you have frequently written for the blog Mothers in Medicine. Mm-hmm. And on that blog, there's so much talk about how to reflect on your own life and continue to reevaluate so that a person is not going down that pathway of burnout. And so I want to ask for you, as a mom of 3 kids and as a DPC physician and as a wife and as an individual, you're wearing all of these hats. How do you go about reevaluating your life periodically to say, yep, I'm okay, or nope, I'm not okay, I got to do something different?
Yeah. We are both on several really active Facebook groups, and there has been a wonderful online community even before COVID. And the DPC groups that we are in have just been, I think, just integral, especially the DPC women groups that really support us, because as women in medicine, our voices are often not elevated. Like every book I found in the beginning was like written by an old white dude whose politics I wasn't so sure if I worked for me or not. I was like, I don't think so. I'm just cross this part out, but I'm gonna take what I need. So that's the number one thing that so many of us are challenged with right now. I think COVID made things even more of a strain. So 4 months into opening my DPC practice, I found out I was pregnant with my 3rd. So she was not planned. Like she was a surprise. And I am very much about intentions. And I was telling like my intention for that year was to grow. So the universe heard that and was like, I got you. I am going to take this up. The universe listened to me. I said, I'm going to grow and I'm going to thrive and I'm going to excel. And the universe was like, okay, you want this baby practice? Here's this baby girl too, in addition to my 2 boys. So for me, my growth and trajectory was a little bit different, right? Slow down because physically I couldn't manage. Like into my first summer of my DPC practice, I was like, I can't take any more patients. Like I literally stopped at month number 6 of taking new patients until I delivered her. And then COVID happened. So COVID happened And of course, I was like taking a baby here or there when like a midwife or a doula or an OBGYN would call me and I'd be like, okay, I'll take your baby. I'll take that baby for you. I'll take that baby for you. But it wasn't like this exponential growth. You know, I'm hearing on some of these DPC listservs, like people are at 150, people are at 200. And I'm like, ooh, I'm struggling at 35. What am I supposed to do? And my husband and my family was just like, listen, you got to cook this baby, don't worry about it, and focus on the practice. And so I just focused really on providing an excellent experience and excellent access to the patients that I had. And they just kept telling more and more people about me. And so when I was ready to grow, I knew I couldn't be a one-woman show. I'm not one of those people that's good at accounting. I'm not good at bookkeeping. I'm not good at social marketing. I will spend 5 hours working on one little Canva post and it will look like my 9-year-old did it. And I will be happy at posting it, but then I'll be mad the next day because I'm like, it looks like my 9-year-old did it. And I just spent 5 hours when I could give it to my assistant, Gabriella, and she could churn that thing out and make it look way better than me in 25 minutes. So for me, it was really about outsourcing. And another thing that doesn't get discussed is that a lot of the men DPC docs, their wives are their administrators. Like their wives are their office managers, you know, and we're sitting here breastfeeding, right? I'm breastfeeding this one while doing a podcast, while doing text and doing all this. And my husband's got his full-time job. He's a professor. Like, where do you get the support? Right now, what I'm trying to do is a lot of us in DPC, a lot of us at the 2.5-year mark, at the 2 to 3 year mark are like, woo, full stop. I'm not paying myself enough. I don't have the systems in place to continue at the level that I am. I set my prices based upon what I thought people could afford. But what you realize is people can actually afford a whole lot if what you're doing is excellent. Like I had several patients be like, Dr. J, you are not charging me enough. Like when your patients tell you that, you're like, oh, or one of your patients who's a marketing exec is like, Dr. J, do more for me, but I charge my patients more. She charges her clients more. It's like a rude awakening. And I'm sitting over here struggling to figure out like, how do I pay for this childcare and how do I do this and how do I do that? Pay yourself more. Pay yourself more. Pay yourself what you're worth. And that's really hard. It's so hard. How do you set your prices so that you can provide the access and the services, but also get the support that you need? Like, how do you pay for that administrative assistant 10 hours, you know, a week, not 10 hours a month? Because a lot of us are like, oh, I'm going to take this person 10 hours a month. No, 10 hours a week. And then how do you scale them so that you let them know for every 10 patients we get, I'm going to add 10 more hours to you. So then you've got a full-time person. You know, right now I'm looking at a practice administrator, like a practice manager person, because I need somebody who understands the business and the systems better than me. Like I figured it out on my own to this point, but at, 60 something patients, there's some automation that has to happen that I don't have any experience in. So I go back to where I go back, I get some training. I am enrolled in courses. I'm in a business development course this summer. I'm getting some coaching this summer. So I'm investing in these systems. I'm reading, I listen to a ton of podcasts from all different genres about how to scale your business, how to stack your team, how to, build these businesses in a way that's sustainable and that your family thrives, because your family cannot struggle, right? Like your family can't struggle. That's the way for you to be unhealthy.
It's so true. And it goes directly back to what you were saying about how if you are a physician who is in a fee-for-service job and hating your life,
yes,
that is not good for your family to be around, because I can totally think of the days when I was extra stressed because I had stayed up till 3:00 in the morning doing notes, and then I got to take care of the kids the next day because that's not my day at work, and I have no patience whatsoever. And I hate those days when I know that I could be a better mom, but I can't because I have to go right back to the job that I hate. And so when you talk about this investment, I'm such a big believer in, if you feel it's going to help you and it costs nothing, it costs $10, it costs $10,000, whatever it is, if you think it's going to help make you thrive, then it's worth it.
But it's hard. It's worth it, but it's hard because you're just like, I'm struggling to get every little bit of money, right? And put it back in this practice. And then I've got to do X, Y, and Z. Like, how can I spend $4,000 on a coach? You're like, because if you need a coach, you need a coach. Like, you got to do it, girl. And I've got friends who are executives who are not running their own practices who are paying quadruple that for their coaches. So it's all about the level that you're at. It's going to hurt a little bit, right? Like it's going to be a stretch. It's not going to be easy. You're not going to pay $25 for a coach and that coach is going to change your life. You're going to stretch and sacrifice and get the coach that you need to get to the next level. Growth is uncomfortable. Everybody says that, like growth is uncomfortable, and it is hella uncomfortable.
And I hope that people take your words to heart, because I love, though, that you even brought up the idea that like it might not work out today, but if that's your goal in that future of not finding yourself on that path to burnout, if it saves you from that path and it's worth saving up for, then it's something to look forward to.
Yeah,
so
you got to do it. You got to do it because we don't want to be those practices that close, right? Like every single week in our women's group, doesn't somebody say they're closing? There's like 2 new people. Hey, I'm opening, I'm joining, I'm opening. We're all like, yeah, girl, go ahead. And then 1 or 2 of the old heads are like, yep, tapping out, can't balance it. I think a lot of this is because of COVID, but a lot of this is because we somehow, like, we're not learning what we need to learn from one another to not make the same mistakes. We're all saying, you got to raise your prices. We're all saying, you got to get the systems down. We're all saying those things. And then we're all so hesitant of doing that.
Mm-hmm. And that idea of our value as physicians in terms of the value that you bring to your patients. Yeah. One of the things I loved is you had an old blog post where you were talking about that you're totally the mom who's going to send clementines or oranges for Valentine's Day and send allergy-free alternatives to school for your son's birthday. And you're also a fan of urban gardening. So I wanted to ask about when you bring your value as a physician who has time into the homes of your families, how do you approach your pediatric patients and their needs and their families' needs when you start working with a new family?
Mm-hmm. So new families are great. They're a lot of work though. Like you also don't understand like with the onboarding process, you don't realize all the different steps. Getting the old records ends up taking 2 and 3 people, like to get old records from the old practice. And then if this kid has seen 3 different practices, you're like, wait, they did what shot at which place and what happened and they lost it. And now this place, people are outsourcing all their records now. Like they're not keeping their records. So you have to send the records request to the main clinic and then you got to send it. So it's all these things. So I start new patients from the first time that they submit their information online, right? Like I'm very much into like, I need to kind of already know some of their story when we're first talking, because I need to know if they had a terrible experience with their last doctor. I need to know if they are worried about something with their pregnancy. I see so many expecting families. I need to know if they're worried about something. I need to know if they're seeing a therapist, right? Because I may need to talk to their therapist before our first visit or something like that. So you really have to listen. And in this kind of practice, like it's wonderful. So I'm an extrovert. I've always been an extrovert. I know so many other podcasts I listen to, they're like, I'm an introvert. And I'm like, I am the opposite. I have to rein myself in. Like I literally have to have a timer. When we were even talking before, both of us are just talking and I'm like, okay, Dr. Marielle, like I gotta go at 3:30, girl. Like these babies are going to start freaking out at that time. So I have to be very intentional about reining myself in with the patients. And I won't say I'm an oversharer because I never share anything that's inappropriate, but just these are members of my community, like it's like medicine is very much about my community because like the DMV, DC, Maryland, Virginia, like I see these people at Trader Joe's. I see them at Whole Foods. I see them at cookouts and stuff like that. So all of my patients, I see them out in the community. At Costco, like I see patients at Costco all the time. So for me, it is very much about being in community with people and knowing what's going on. I know summer camp programs that I can refer specific patients to because my kid has been to that one and I know your kid really well and your kid is going to love this. And my patients are always like, oh my God, that camp you sent me to, Dr. J, that was the one for him. Or some of these mommy groups that I've been in, I've got a 10-year-old, he's almost 10. I know mommy groups in Virginia, DC, and Maryland because I've been a part of all of them. So I can literally be like, hey, you should contact such and such because she runs this group and tell her I sent you. And then, do you mind if I text her and tell her you're coming? Yep, do it. And I'll text and say, some of my parents were so overwhelmed that I would refer them to a therapist, but they wouldn't call. And I'll be like, do you want me to text her and ask her to call you? And they're like, yes, please. Yep. And so I have wonderful relationships with wonderful referral community that like so much of the work is just about getting to know the families from the first call that we have. Everybody gets an interview. And then during the first visit, I literally just sit there and we talk and I listen. I want to know what your priorities are. Like I really try to center their priorities. Of course, I've got the things in my head. Like I want to make sure your baby doesn't have cystic fibrosis. So I'm going to do your newborn screen. But I also want to know what you're worried about. And the wonderful thing about practices like ours is that we can be very intentional. And my background in public health, I can be very intentional about setting up things that my patients need. So when they're asking me questions, I'm like, let me flip through the Rolodex of people that I know. Like all my newborns were having like terrible gas. The parents weren't listening to me that gas was normal. So I was like, let me call the head of Georgetown PGI because I reached out to her and I was like, hey, Dr. Mary Estella, all my patients have questions about gas. Can we hop on a group visit? And she came and we did a group visit. So I literally do group visits based upon what are the questions the patients are asking me because they want to just hear it from somebody else. So we literally talked about farts and poops and gas for an hour with the head of GI at Georgetown. And I got several referrals for them through that. Patients that I have been telling, hey, I want you to go see such and such. Nah, I don't want to go yet. Okay, all right. Well, she's going to come here. You see, she's not going to bite you. She's very sweet. And now they're going to see her. That's my job. Just listening to people, sitting down with people. I have lunch with my patients sometimes if they've got like feeding issues. I literally will be like, can I come at breakfast? What time's breakfast? And they'll tell me and I'll be there. And I'll sit there and eat, they'll eat and they'll feed me some stuff and I'll watch them and I'll coach them on, oh, you see that apple there? Like, you don't want to eat that apple? Girl, I don't want to eat the apple. Just take a bite. I'll take a bite. You take a bite. And then we take a bite. And the mom's like, they took a bite. It's just wonderful sitting at people's tables, sitting on the floor. I sit on the floor most of the time. I crawl around. I play outside. It's nice.
In none of that do I hear fee for service. It's so opposite of what you live every day when you have somebody check your patient in. Okay, this is the next patient and you have someone else in 15 minutes. So that's amazing. Now, I want to ask about the logistics of your practice when you have somebody going to your page, especially for somebody who's like a new family and there's an inquiry. On the bottom, it says that you have your page run by active campaigns. So I'm wondering on your end, when a family fills out an inquiry to be a new patient in your practice, what happens once that information is submitted on your end?
Yeah. So one of the wonderful things too, with my background in public health, I have a family advisory board. So I do have people who like check things out from me and tell me. Patients are wonderful, but they often don't want to hurt your feelings or tell you that something's not working. And so I nominated and reached out to like my most vocal patients, the ones who always have something to say. I'm like, I want you to tell me, and you officially are on the family advisory board. I've got a newborn family. I've got families of children with special needs on this family advisory board. And so literally, if I have a question or want somebody to check something out, I can send between 2 and 5 emails and they'll check it and respond to me. And maybe I'll get like a few responses because everybody's busy. So I was very intentional about the website and things. I will say I started with Wix for my webpage, and Wix has a built-in customer management software that was very intuitive and very easy to use. But my wonderful web designer who I've been working with for, Valerie, I don't know, 15 years. Like I've been working with her for a long time on multiple different campaigns. She wanted to learn how to use Squarespace. So she was like, I will transition your website to Squarespace. It's going to look so much cleaner and I'll do that for free. And so you hear free and you're like, oh yeah, let's do it. No, don't change your website in the first 4 years. Like multiple people tell you, I read after the fact, they're like, don't change your website. Nobody really cares about your website. Leave it the same for 4 to 5 years. I should have left it. Huge task. But I am happy. I love the way the website looks. I think it fits more with my aesthetic. I am a pretty simple urban gardener gal, a little bit fancy. So it is like my perfect aesthetic. It does not have any built-in software for that management. We had to choose between Active Campaign and something else. And I'm very much into, does it look the way I want it to look? Or does it like make me mad when I look at it? And so Active Campaign, like there were just so many different things that you can use. It is not a very intuitive system. It is a little bit difficult to use, but the way you're able to drill down what you want works better in the end. We have several different lead pages. I think you were asking about this as well. Like, why do I have the different forms? I don't like back and forth emails. It's one of my pet peeves, like scheduling emails. I'm like, if you don't send me a Calendly link, I'm not going to talk to you. Like, I just can't do it. I got too many kids. There's too many things. I'm going to check overnight at 1:00 when I don't want you to know that I'm up still working. I'm going to do the calendar stuff then. So I can't talk to you during the day about the calendar. I wanted everything to be automated where I get like the information that I need, because I do house calls. Number one, I need to check the address, right? Like I need to make sure that people are not outside of the range that I feel comfortable driving. I don't want to drive an hour and a half to go and see people. If your kid gets sick in the middle of the night, or your kid gets sick on the weekend and I need to come and see you, or your kid gets sick during rush hour, it's going to take me 4 hours to get to your house. And I'm not doing that. So I wanted that information. I wanted to know how many kids there are. I wanted to know what the kids' names are so that we can already set up in the system. We can send out automated birthday emails, you know what I mean, with your kid's name in there. Do that work up front so that on the back end, my team is not spending 15 hours. Now, those were mistakes that I made in the beginning. I didn't know that would happen, but now I do. And so we set it up. So I have the page where patients are interested. They submit their information. As soon as they submit their information, they get an automated email that nobody has to touch that gives them my availability during usual times. I have a wait list now. So it takes you get an automatic email that says you're on our wait list. Our team gets a notification that somebody has been added to the wait list. And then we work through the wait list as we have the time. Previously, what would happen is they submit their information, and as long as they're within the range and we tag them, they automatically would get my availability, which is really nice because then they'd be able to schedule a time to chat with me immediately. And that cuts down on the back and forth. For a while, it was my assistant would have to go in there and check people. Like, no. So we automated it. And I also have that for people who are interested in like business conversations and other DPC doctors or people who are interested in DPC. We set it up so that it's all automated as well.
And one of the questions that you had asked about, even on the DPC doctors in the house group, was about the cell phone. So I want to ask you, because you alluded to sometimes you are guilty of the 1 a.m. check the Calendly links, but how do you take care of your family and the cell phone for your business?
So my assistant actually told me that she was telling all of her DPC docs to get another cell phone. I didn't want to get another cell phone, but she's like, Dr. J, I see she has several other DPC women that she serves as their administrative assistant, their virtual assistant. And she was like, y'all have to get a separate phone so you can shut that thing off, so you can put that thing away. And so I just got, was it last month? I got a different phone. And I reached out to some docs on the DPC women group to say, hey, how does your phone tree work? So we use an app called Spruce, a lot of us, as our number, and you can set up a phone tree. And I had a very basic phone tree that was like, press 1 to get in touch with me, and then press 1 if you're a patient, and press 2 if you're not. And so everybody would be ringing my phone all day, and it'd just be ringing off the hook. And you get so distracted that you can't focus. So I actually last night sent Bruce an email with a very detailed, like, press 1 if you are a patient and have an urgent issue. And then they get routed to an urgent phone number. So I have 2 phone numbers for the practice now. One is an urgent number that only the patients and providers have. And then 2 is the general number. And so I set it up, the phone tree, so that it will take people through a very detailed phone tree. Just like when you call a hospital, it's going to be the same thing. And I'm setting it up so that, like, general, like, business phone calls, I don't want them interrupting me during the day with a ring. Like, even though in the past I did, and it will not ring anymore when the general people are calling. Because, you know, I mean, as soon as you open up your practice, you're going to get all these phone calls with people. Hey, I want to meet with you to talk about this software. Hey, I want to meet with you to talk about this billing software. Hey, I want to meet with you. You don't want them bringing you. You want to be able to talk to them when you want to. And the nice thing about Spruce too is that it transcribes all your voicemails. So I don't even have to listen to their voicemail. I can just look at the transcription, click the button, and call them back. And I take notes on every conversation right in Active Campaign. So any notes that I have with people who are not patients go in Active Campaign. Any notes that have to do with patients go right in my electronic medical record, and there's nothing else. I stopped putting things in email. I stopped putting things in Google Drive. I stopped doing all of that. If you are a potential patient or a business, you go in Active Campaign and you have a contact. And if you are a patient, everything goes for you in the electronic medical record. That was one lesson learned as well. So 2 cell phones, big old phone tree, auto responders when people send text messages. I have also cut down on when people call and say, hey, I'm interested in becoming a patient. I'm like, do you accept text as this phone number? If they say yes, I immediately have a text message saved where it says, hey, this is Dr. J of Healthy Home Pediatrics. I like to personally meet with every single patient. Please go to my website. Here's the link. Submit your information so that you can get my info, so that you can schedule a time to meet with me. And I tell them that's because I'm busy with patients and I will lose your information. And it will be 2 months from now. You're going to be calling me and being like, Dr. J, you said we were going to talk. You never sent me. Nope. Go right to the website. That is the place where all of your information will stick. And I just tell them I'm so busy taking care of patients and my family. I don't want to lose your information. So I always now send people back. I was really nervous about doing that. But my assistant, again, Gabriella, really had to push me. She's like, Dr. J, you forgot to email somebody back again. They wrote back and they said they've been trying to be a patient for 2 months and you didn't send them something. You have to send everybody to the website. Because sometimes I was sending people to my Calendly and she was like, Dr. J, now you don't have record of who they are. This person scheduled time with you and you don't have them in the system. She send them back to Active Campaign. So that was a really good lesson learned.
Huge tips there. That's amazing. Thank you so much for just dropping all of that knowledge on everybody. That's perfect.
Don't make those mistakes.
Yeah. This is where that mentorship, though, it's so important because you've been there, you've done it, you've learned how to improve and make your practice what works for you. So that's awesome. Now, as a mom of 3, how did you handle maternity leave?
So first of all, your patients will be fine. That was one of the questions that came up on one of the DPC women groups. And we all need to take maternity leave. We should have paid maternity leave in America. And if we don't do it, our daughters are not going to do it. And we have to do it. So I remember being a resident and people would come back in the 4-week mark, hobbling into the hospital, right? That's not healthy. That's not safe. You don't want to model that to your patients. And especially in a DPC practice, they're going to know, Dr. J, didn't you just deliver last week? Why are you here at my house? They don't want you there unless you need to see them. So I was very intentional I had already breastfed 2 other babies. I knew what it was going to be. I knew the support that I had. And so I did complete radio silence for 2 weeks. I was like, I won't touch my phone for 2 weeks. Literally, I'm going to turn it off if you guys need it. Dr. Matthew Hayden and Dr. Marguerite Duane of Modern Mobile Medicine have been great friends, great colleagues since before I started. They cover for me along with Nurse Heidi Johnson of House Calls on the Hill. So I have 3 local providers who do house calls, who cover for me whenever I need them to. And they've been amazing. I sent them Panera gift card last night just to be like, thank you, y'all. You always cover for me. And I did complete radio silence for 2 weeks. My DC patients knew who to call. My Maryland patients knew who to call. My Virginia patients knew who to call because I am licensed in all 3 of those places, but not everybody is licensed in all 3 of those places. And so I put that in my newsletter. I told them at the 2-week mark, I would let them know in an email and a group text, what it was going to be. And so at the 2-week mark, baby was doing fine. I said, I will come back to phone triage because sometimes they just want to tell me an update about the rash that I've been managing for 5 months. The on-call person does not need to know about this rash that is chronic. Mom has a question for me. So I did that. It was the beginning of COVID. So I actually didn't go back into anyone's home until the baby was 2.5 months. I was doing all telemedicine. And I have been doing telemedicine since I started the practice because I was like, it just makes sense, for rashes and different things to just do telemedicine. So it wasn't a pivot for us. Everybody in the practice already knew, pretty much everybody had already had a telemedicine visit. It was really good. I was literally sitting right here or sitting upstairs with the baby, nursing the baby, and she would be on the phone calls with me. And half the time people didn't even know. Until she was about 9 months and started moving around a lot, people didn't even know that she was in the call. She's here. She's here right now. She sleeps. And this is what she does. So it's very important that we take real maternity leave because infant and maternal mortality are terrible. I know so many physicians with preeclampsia, high blood pressure, really traumatic pregnancies and traumatic births. And part of that is, are you going to be supported afterwards? Do you know that you have a system set up afterwards? Can you just let go of the practice, have people who have your back, and know that you can take off that time? Now, what would it have been if I didn't have anybody to cover for me? I'd have been really nervous. And heaven forbid I had a bad pregnancy outcome because I was stressed. I didn't have to worry about that because I knew Matthew, Marguerite, and Heidi had things under control. And Nurse Kimmy, who is my nurse who's been with me since the beginning, I knew she had things under control as well. And Gabriella, my assistant, I knew she would be there as well. So I had a team in place. And I was very intentional about taking that time off of the baby. And it was the best postpartum experience. My second postpartum experience as an employed physician was terrible. My boss actually, I went back at like the 6-week mark, and she actually docked my pay one time, like $300, because she said I was doing excessive pumping time. Like when I reached out to her and said, hey, my paycheck is $300 short. Like this money is really important to my family. She said, oh, I docked your pay because of excessive pumping time. You were away from the patients for too long. And I was like, but I had been asking for a dedicated break for me and the nursing medical assistant. There were 2 nursing staff members at the time. And she said, no. She said, the way that our contracts are set up with the Medicaid programs, we can't close the clinic down for more than like 30 minutes. That's not true. Like multiple people have told me that is not true, but that's what she told me. But when you need your job, I was a worker. And when you need your job, you can't push because you could get fired. And if I had lost my job, it would have been detrimental to my family. And so I didn't push, but it hurt really bad. And so what I started doing is I would let her know in my invoices, like during my 35-minute time out of the workroom, I spoke to this pharmacist, I did this refill, and I spoke to these patients. I never took a break. Even before that, my pay got docked. I was like, I wasn't taking a break. I was working the whole time I was pumping with my hands-free pump thing. Yeah, that's part of the reason why I left.
Yeah. And, on so many levels, I'm glad that you left, but you talk about, oh, you can't have a scribe, you can't talk to people on text, but when it hits home and it's your children, oh man, the day that I created this podcast, I've said this before on air, but when my company said you either sign our RVU contract or be fired when I was 28 weeks pregnant and not going to have health insurance for my baby, that was my day. My
That's so manipulative. That's so abusive.
It is. And that when you talk about that, every physician typically has this experience of they could not stay in the system 1 minute more. Yeah. Everybody has their why, but when it hits your family, that's where a lot of us, especially as moms, draw the line.
Yep.
So now when you talk about having this practice where your patients are understanding of who you are, they want you to be a mom, they want you to be successful at all of the hats that you're wearing. One of the things that you had to choose along your journey is an EMR. So I want to ask, what EMR are you using, if you're okay sharing that? And what words of advice would you give to others when they're choosing an EMR in terms of how they will use that in the future?
So my EMR, right before I was opening, I guess like 6 months before, I knew I needed an EMR. I knew I needed like a practice management software. And I knew I needed some kind of telecommunication. And so I did like 3 or 4 demos with each of those things and talked to other docs about what they were using. I love tech and was an Epic super user as a resident. Like we were able to be Epic super users if we wanted to like do additional training. And I was like, oh yeah, I'll do additional training just so I can be a physician champion of the EMR. So I've used like eClinicalWorks, Amazing Charts, Cerner. Like I was going through all the different EMRs I've used. I don't like any of them. Like none of them are optimal. I'd say Epic was my favorite one, but it's really expensive. And I knew I couldn't afford Epic and you needed to be on like a regional system. And I was like, yeah, this doesn't make sense for me. So I interviewed, looked at Atlas MD. I looked at Serbo MDHQ. I looked at, there was another one. Charm wasn't out yet when I first started. Elation, I think, was out. And there was one other one I looked at. And the functionality in most of them is pretty much the same. Atlas is a good kind of middle of the road, can do everything. I think Serbo has some functionality that is a little, I guess, is more flexible with some of the chart parts and stuff and things like that. And I loved those things. And for me, it just went down to the way that things looked at the end. Like, can I look at the screen all the time? And does it make sense? Is it intuitive for me? And so that's how I ended up choosing Serbo MDHQ. There's so much optimization in it. I do wish there were like physician champions almost that could walk you through every now and then. Maybe I'll pitch that to them someday, that I'll be like a physician champion and I can walk people through how to use it. Because I think it's different when we as doctors and providers use things versus like administrators use things. Like I want somebody to like walk me through your note. Like how do you, from the time you prep for your patient, to the time you see the patient, to the time you sign your note and give them an invoice if you want to. Like, I wanted to see all of that. And so thankfully, Andrea Wadley of 123 Pediatrics and then Matthew Hayden of Modern Mobile Medicine, they both used that Serbo. And so I was able to spend some additional time with them. And I just would email them and be like, hey, can you take 30 minutes, take an hour with me and walk me through what you do. So I wish in the beginning I had used more of the system optimization aspects. I wish I had done all of my forms right in the EMR. I remember in the beginning, I was like, I want custom forms. No, you don't want custom forms. You want the form that is embedded in your electronic medical record so the patients can click and it goes into their chart. You don't want to have to download, because once you get past 15 patients, you are going to have a staff person who is spending an hour or two a week downloading all those forms. Another lesson learned, use what's in the system to the max. It may not be perfect, but it'll at least get you what you need. But you don't spend more than 5 seconds reviewing those forms anyway. Does it really need to have your logo on it? And let them put it on it.
When you talk about optimization, is there a particular workflow that you've designed that is just amazing, that you're so happy that you have now?
No, I'm still working on that, right? Like part of what I'm doing this summer with the coaching program that I told you that I'm going to participate with is I need to figure out how to make things flow from the time that, the patients sign up. I get all of their forms. Like, how do I make sure I'm checking the boxes so that things are where they need to be? And I think, again, that's part of the learning pains that I went through using all these different systems. That's a different system. You got to log in and make sure to do X, Y, and Z. Like, I need to make it so that everything is in Serbo and everything is an active campaign and I don't have to go anywhere else. But then I've got Spruce too, right? So that's 3 different systems that I constantly have to think about. What did I need to do in Serbo? What do I need to do in Spruce? What do I need to do in Active Campaign to make sure that these patient records are all vibing? So I don't know. I don't have an answer, a workflow that I'm happy with, that I get to listen to the patients, that I get to be with them. But every time I go out of order. Oh, I guess I will say Active Campaign, keeping things on Active Campaign completely before they become patients has been very helpful, because before I was like doing a pre-chart in the system for them, and then it wouldn't translate with what was back in Active Campaign. And then I'd have all these open notes, but they weren't patient notes, and it would get fuzzy in my brain. Like, do I have 15 notes to do or do I have 20 notes to do? So I will say that I'm proud that I've separated that. I'm proud of the new phone tree that I told you about. Now, I haven't put it into practice. So what's going to happen next week when people start using it, I'm sure there'll be a mistake. I'm sure I'll have to go back and fix something. I guess that's also something that has been a good optimization, is just embracing the mistakes and embracing it as part of like your versions. I've heard in a lot of podcasts how they're like, the iPhone is on like iPhone number 14, or 12 or something like that. Like, your business is going to go through all these iterations and you just had to embrace it, because it's the only way you can get better. But you got to fix the bugs, right? Remember, we used to get all these updates. Oh, the iPhone has a bug. Here's your patch for that. Your practice is going to have that. And you literally have to embrace that your practice is going to have a glitch. You need to go back and fix it and keep moving.
And it just goes back to Angel Kyoto Williams' quote with this idea that without collective change, no change matters. You're literally taking a look at your practice as a whole to make changes for the future. So it's beautiful. Yeah. Now, one of the things that you are very big on, and I don't know if this was impacted by COVID or how you pivoted there, but you are a mom who has a ton of community involvement. So I want to ask, in terms of when you collaborate with, like, you collaborated with a breastfeeding group, you've collaborated, recently attended your Zoom where you talked about summer camp and swim safety. How do you build out these intentional collaborations in your community?
Yeah. So when you come to visit our house, you will see that one of the first things that we have on our mantle is a poster by an activist that says, if you've come to help me, you're wasting your time. But if you've come because your humanity, your existence is bound up with mine, come, let us work together. This practice is literally because this is my community. This is where I live. Like, when children are healthy, my children are healthier, and then vice versa. So our humanity is literally tied up in one another. tied up. So many indigenous cultures around the world tell us that as well. The water keepers in South Dakota, like all of these people are telling us that our existence, our humanity, our wellness is bound up in one another. So it's just a part of it. So the picture that you saw on social media where I was highlighted as like a community leader and went and read books to the kids. I read my favorite books to them. Literally, that's my son's summer program that he participated in and did after school. And so, of course, when Miss Vanessa of Polite Piggy says, Dr. J, you've been in the community doing the work for all these years. We want to highlight you. Of course, I'm going to go. I'm going to go and I'm going to talk to these kids that see me every day at pickup. The breastfeeding center class that I volunteer with, when I was pregnant with the 9-year-old that keeps picking around here, when I was a pregnant medical student, I signed up for their free breastfeeding course. And that was the first place that I learned about breastfeeding, that somebody showed me how to hold a baby and breastfeed him and get him latched. And it was a free course. I waddled in during a break from class, went to the breastfeeding class, and then went back home. And of course, I'm going to give back. Like that class probably should have cost like $300. So I'm going to give back so that people like me, all these moms in the area, all these moms and dads, these birthing folks, because we're inclusive on purpose, that all these birthing folks have that information as well. It's my hood. It's my community. It's where I live. If I'm not there using all this information in my head, all these resources in my head, who's going to do it? These big companies aren't coming to save us. It's literally us mamas figuring it out, making it happen for our communities.
Wonderful. Mm-hmm. And I definitely would encourage people, if they are wanting to do more community involvement, take Dr. J's words and just live with them for a few moments and just think about, if you want to do community involvement, there's so many ways, and reach out to other DPC docs, if on the women's group or on the regular DPC docs group, if you're not sure how to get that community involvement going, totally reach out. So many people are doing walk with a doc. So many people are doing cooking classes. So many people are doing things where they aren't necessarily in person doing them. So there's lots of opportunities out there. Now, fun questions with regards to being a pediatrician. I want to ask your best tools. So what is your best tool for ear cleaning?
So I love the alligator clamp. Oh my God, I love that thing so much. My kids are like, if you don't get that thing away from me, I'm like, oh, I think I see something. Let me use it. And they're like, get it away. And I love my alligator clamp. I love just a good old butterfly syringe kit that you can just cut off that needle and flush that ear out with hydrogen peroxide. I love a nasty ear. That is like one of my favorite things. Ooh, it's so fun. My kids and my husband are like, oh God, she wants to flush our ears again. Yeah, she's flushing our ears again. Yep, I am. I love it.
Fantastic. Oh my goodness. That's the best part about being a mom. We have our family to be our patients first and foremost.
Oh, yeah.
Foreign bodies up the nose.
That mother's kiss, I know it's nasty, but I'm just like, mom or dad, you handle that first. Like literally just blow. Close your nose, blow through, pop that thing out. And then I'll go to my handy dandy alligator clamp.
Pain distractor for things like shots.
Oh, my Buzzy. DPC Women Group. We've got docs in Canada. We've got docs internationally. Who would have known? Like that was not a part of our training, like pain relief, other than breastfeeding during vaccines for infants. Nobody ever talked to me about like, well, I guess we did a little bit of EMLA cream if kids, had ports and things, but like I use EMLA cream on everybody now. I use the Buzzy Beat on everybody now as a distractor. I've got teens that are like, did you take the blood? And I'm like, oh, I'm done. And they're like, oh, Dr. J, I love this Buzzy thing. And I'm like, yep. So Buzzy Bee and, of course, breastfeeding, number one for my infants, EMLA cream and Buzzy Bee. They're my favorites.
How about your favorite Band-Aid?
What's coming free from the lab? I'm not buying Band-Aids. For what? No. I've got like hundreds of Band-Aids in there for free. They're not cute. And they're definitely like that pale beige that doesn't even look like anybody's skin. But guess what? That's what we're using. They're really strong, that adhesive. So I do tell parents to put the babies in the bathtub the next night and to just soak them off. Once they look wet, pull them off. But yeah, no, I'm not paying for Band-Aids.
How about home visit tool?
My favorite or the one that I actually want to fix?
How about both?
So my GPS, because I have a terrible sense of direction. My GPS gets me everywhere. Like I said, I have 2 phones and all the patient information is in the work phone so that like my GPS is set and ready to go. And I like check I check Google Maps and I check Waze to see which way gives me the best traffic. And then I love my bag organization, which I talk about a lot on our DPC Docs in the House group. I talk a lot about my bag organization because I tend to be a clutterer if I don't have things. Like I've labeled exactly where everything is going in my bag, because otherwise I just throw stuff and then I get overwhelmed and I'm like, I'm not doing it anything at all. So I have a label maker and I label things completely in my little crap organizers. I will be designing a bag pretty soon for exactly how I want it to be. So maybe we can work on that together, or anybody who wants to, we can work on that together. So we need like a good DPC Docs in the House bag, like that all of us like maybe design together.
Perfect. And keep us posted on that because that's super exciting. And I think that especially those who are doing home visits listening to you are just like, oh my gosh, they have all the ideas.
Tell them call me. Because I actually have just started thinking about that because none of the bags are perfect. Like the makeup organizers people use. I'm like, I don't want a makeup organizer. And like I use a sewing machine bag. Like, it's just not the bag that I need. And then other people like Dr. Rosanna use this big industrial bag. And for me in the city, I can't do that going up and down on third floor walk-ups. So I need something that's in between that. But nothing exists because like I said, I am a student of history and research, and I have researched the heck out of these bags. So nothing exists of what I really want. So call me if anybody has any ideas about how to make that happen. I got some ideas.
Love it. And before we get to your contact information, I want to ask you are a fan of gardening, of podcasting, of cooking, exercising. What are resources that you love to share for anybody and everybody that you talk with?
Yeah. Ooh, this is a fun one. So I think podcasts, we talked about, I absolutely love podcasts. I listen to them when I'm getting the kids dressed. I listen to them on my way to go to all my house calls. I've got all my business podcasts. So I think in seasons, like when I was first starting out, I was listening to all these like startup business podcasts. And it wasn't just DPC. It was like How I Built This, NPR's How I Built This is a really good one. Side Hustle Pro with Nicaila Matthews. That is such a good one because you get to listen to all these people, especially women and mostly women of color who started all these different businesses and learned from them. And I've gotten so much from them. Let's see. Other podcasts are like more about like marketing and things. When I just had no idea how to do anything about marketing, I just like dove into marketing podcasts and marketing books. And now I'm in like the systems optimization books. I'm doing a lot of building teams, and Stacking Your Team is the podcast that I love with the Biz Chicks. They are like service-based. Everybody knows them. Natalie Ekdahl. I think finding a tribe is important. So I started like a business mastermind of other folks in the area who run businesses. And all of us are women. All of us are women of color, and we all run businesses that have to do with healthcare. And so me and a pediatric dentist started this group, and there's like 10 of us, and we meet every single month. We've got a psychiatrist, we've got a psychologist, we've got a doula, we've got a midwife who's been in practice for 30 years. You know what I mean? Like we've got people at all different stages. We got pediatricians. We have several pediatricians, a family medicine doctor, and we get together and learn together. A few of us read Natalie Ekdahl's book, Reset Your Mindset. And so we're going to get together and discuss that book. It probably will be virtual just because of COVID. I think applying for grants, like I think I've mentioned that on like the DPC Docs in the House group, like I've applied to some grants. It's a lot of work up front, but it also helps you envision what you could do with your practice. So writing these grants lets me think of the most amazing program that I want to start with my practice, and like maybe I can get some funding for it. And the grant might not be exactly perfect for you, but it gets you writing, it gets you thinking, it gets you talking to people. So I'd say podcasts, I'd say books. Other resources I always send people to. I mean, I love, as a pediatrician, I love kidshealth.org. It's my favorite website. I like, is it Scarletine for my adolescents? Scarletine is a really good, body-friendly, inclusive website about reproductive rights and bodies. I love the 0to3.org, and it's all words, 0, ZERO to 3.org for like development. Really good videos on there for parents. So those are the resources that I use most of the time. And I love biographies and just like motivational books too.
Wonderful. And Dr. J, for those who have been super inspired by your talk today and want to reach out, what is the best way to reach out to you after this podcast?
Yeah, go through the website. We were talking about systems. Like I get overwhelmed when I don't like the back and forth emails. I get very overwhelmed very easily because I will forget that your email is there and then I'll feel so bad. So I don't want to feel bad that I missed your email. So the website is the perfect place. My assistant and I check the information when people are at any stage of their DPC, they can submit their information. And again, like it is because we are a part of this community. This is our community. When I was starting out, so many people took an hour, took 2 hours, took multiple Saturdays to talk to me while driving their kids around. So of course I'm going to give back and do the same thing for people, but I needed to do it in a way that works for me. They were fine with me just like emailing them and setting up a time. But I knew if you email me more than twice to schedule something, girl, I want to delete your email and I want to forget you exist because I'm stressed because I can't keep up with the emails. So I knew I had to automate it. And so that's why I just put it on the website. DPC docs want to talk to me, just go to the website. There's a business collaboration tab. You scroll down for business collaboration. Some people don't want to do telephone visits. They want to do video. Some people are done with video. They want to do telephone. People can choose from there. Like you choose how you want to talk to me and I will make it happen. I only have the times on there that I look presentable for video. So you're not going to get the times when I shouldn't be talking to you on video. And then the DPC calls, I had to restrict those because I was getting like 4 and 5 people a month that wanted to talk and it gets overwhelming. And so like I limit it to like, I think it might be 3 a month because there were some months it was like in the fall, people were all opening up DPC practices and I was just getting all these requests to talk. And I remember one week in particular, I think I talked to like 4 different people and I was like, I didn't have enough time to talk to my patients because I was talking to people who wanted to open up DPC practices. And I'm like, that is not sustainable. So don't worry, submit your information on there. Only the availability that I want you to have is on there. And I think I only talk to people who are interested in DPC. Like I've got a few hours twice a week just so that I could like not be overwhelmed. Yeah.
Awesome. Thank you so much, Dr. J, for joining us today.
Thank you. So nice talking to you.
Next week, look forward to hearing from Dr. Shane Purcell of Direct Access in Anderson, South Carolina. And if you're just starting out or looking for help with marketing and lead capture, be sure to check out Marketing Beaver. For as little as $3 a day, they will help your marketing game be on point. They have an exclusive offer for My DPC Story listeners where they will help you get your marketing started through a pitch video. And Global Ultrasound Institute is offering 10% off registration exclusively to My DPC Story listeners for their next 2-day in-person event coming in October in San Francisco, California. Check out our website, mydpcstory.com, for more information and to check out these discounts. Also, there are still some incredible DPC Alliance Masterminds coming up. Use the code MyDPCStory, one word, all caps, when you register at dpcalliance.org. If you like what you heard today, please leave a review and subscribe wherever you listen to your podcast. Tell your friends too. For more information on this episode and much more, including DPC swag, please visit mydpcstory.com. Also, for the latest in DPC news, check out dpcnews.com. Until next week, this is Marielle Conception.